You're listening to Health Professional Radio. I'm Tabetha Moreto, the host for today. Our guest today is Toni Riley. She is a pharmacist and has for many years practiced as a community pharmacist and a consultant pharmacist, providing medication review services to the community and in the aged care. She has been the project manager of the national project called the National Return and Disposal of Unwanted Medicine Project, also known as the RUM Project, since 2015, and during this time has commissioned a national audit and general population survey, and most recently a public awareness campaign for the RUM Project. With all that said, welcome to the show, Toni. It's a pleasure to have you.
Thank you, Tabitha.
Okay, so can you please tell me, why do we need to dispose of medicine safely?
Well, the main reason, of course, for disposing of medicine safely is to protect the community and the environment. So it's really important that people don't throw their medicines in the rubbish bin because, of course, they end up in landfill and ultimately in our waterways. So that's something we don't want to happen. So the best way to do it is to take them back to your community pharmacy, where they will put them in what we fondly call a RUM bin, a return unwanted medicine bin, where they eventually are all incinerated.
Okay, that's a good thing to hear. So can you please tell me, why should people not keep medicines no longer needed or expired in the home? What are the dangers involved here, Toni?
Okay, the best reason for not keeping medicines that you don't require any longer is a safety reason. It's especially poignant when you've got young children in the house. Over 5,000 children are admitted to hospital every year because they've accessed medicines that in their parents' medicines cupboards. But also, obviously, medicines expire, and once they're expired, they're generally not a lot of use. They're potentially a lot less effective, so people may not end up with the result that they expect.
Yes, I absolutely agree with you, Toni, because in my case, I have a daughter myself. She's 2 years old. I have to make sure that medicines are out of her reach. As you know, children at that age are very curious about things.
Mm-hmm.
All right. So, Toni, what do you suggest to people who want to keep medicines just in case?
Well, it is a temptation to keep medicines just in case, I grant you, because obviously they've cost the person money. But the reality is that not many medicines are really worth keeping for just in case. There's certainly not any reason to keep any leftover antibiotics if you happen to have any left, because you just don't know whether the next time is going to be the same infection, so consequently you need to go to the doctor. Painkillers, strong painkillers, are just dangerous to keep around. Medicines that you are no longer have been prescribed and no longer require, or they've been changed for some reason, it's just no point keeping them because it's unlikely that you're going to need them again. And if you do, it's probably better to be buying them again or getting them prescribed or dispensed again.
Yes, that's true. It's better safe than sorry. So, Toni, now tell us about this amazing program that you have. How does the Return Unwanted Medicines program work exactly?
It's a really simple program. It's completely funded by the Commonwealth government and has done so since 1998. And community pharmacies around Australia all have RUM bins. So all a consumer needs to do is collect up their unwanted medicines and take them into the community pharmacy, where they'll get rid of them for them free of charge and completely without any questions. Nobody's going to ask any questions about why you had it or why you kept it or any of those kind of things. And privacy and confidentiality is really an important thing in pharmacy, so there's absolutely no concern about anybody knowing anything about the medicines you take back.
So what happens to the medicines once they are returned to the pharmacy, Toni?
Well, once they're returned to the pharmacy, the RUM bin, once their bins are full, they're sealed up with a tamper-proof seal and transported to an EPA-approved high-temperature incineration facility, where the bin and contents are incinerated.
Ah, I see. Yes, that sounds interesting, because these kinds of medicines can't just be thrown in the trash. They have to be disposed of properly. All right, so
That's
Toni.
Exactly correct.
Yes, so now can you tell me, why can't the medicines be sent to third world countries instead?
Well, there's a couple of reasons, but some very good reasons in some Australian guidelines are available. And these guidelines were developed because of events that occurred in the past where loads and loads of unwanted medicines had been, or medicines were sent that actually were unwanted medicines to countries where they'd had disasters. And like there's an example in Guatemala, admittedly 1976, but 7,000 cartons were donated of medicines. It took them 6 months to sort the drugs out, and only 10% of the medicines sent were actually relevant to the health needs. So it's recommended that if a country wants to send medicines, they need to contact the country they're wanting to send them to, find out what medicines they require, and discuss with the appropriate people whether they want medicines or they want donations. And the other thing that the Australian government is very strong on is the fact that if the medicine is unwanted in Australia, then it should be unwanted overseas as well. So the collection and redistribution of any unused medicines is not permitted in Australia.
Yes, that's true. If it's not good in Australia, it's not good anywhere else in the world.
Yeah, and if we're choosing not to use it, so why should we give it to somebody else?
That's true. Okay, so Toni, what is the environmental impact of not disposing of medicines responsibly?
Well, as I mentioned earlier, it's potential for medicines that are put in the rubbish, which end up in landfill, or a significant number of people tip them down the drain or flush them down the toilet. They also end up in our waterways. And particularly our aquatic animals, there's been quite a considerable amount of research done, and that's ultimately affecting marine life. So we don't, that's not something that we're wanting to do. We're wanting to protect our environment.
Yes, that's true, because as much as possible, we have to protect the environment as well as the people.
Oh, absolutely, yeah. And we've got a simple way of doing that. There's community pharmacies on lots of street corners around this country. People, on average, are no further away than a couple of kilometres from a community pharmacy. They're open long hours, so that's easy access to take your medicines in and have them disposed of appropriately.
Okay, so Toni, I know that you've been a pharmacist for many years now. Have you had any customers share tales of when medicines have ended up in the wrong hands?
Not exactly in my pharmacy, but I've certainly had people share tales with me of medicines ending up in the wrong hand. A young mum had her little girl just left for about a few minutes while she went outdoors to collect something off the clothesline. The little one climbed up and got into the medicine cupboard and took some melatonin capsules and some strepsils. And she ended up requiring supervision in hospital for a short period of time. Fortunately, she was fine. I know of another older lady who accessed, had medicines that she'd had from a previous operation, some painkillers, and she accidentally took those instead of another tablet because they looked the same, and she ended up quite unwell in hospital. So it happens with the young and the old and everyone in between.
Yeah, that does sound very sad. Like I mentioned earlier, since I'm a mother myself, I have to make sure that medicines are out of reach of my daughter because I don't want anything to happen to her. All right. Yeah. So, Toni, that was a very nice thing that you have said today. And it's very interesting, this project that you have developed regarding the disposal of unwanted medicine. So now, Toni, what is your takeaway message to all of our listeners out there?
Well, I guess my takeaway message, and it's to everybody, health professionals as well as non-health professionals, because we all have medicines in our homes. So go and have a look in your medicines area, read the labels, check your expiry dates, remove anything from the cupboard or the storage area that you no longer require or is expired, pop it in a bag and take it down to your community pharmacy where they'll happily dispose of it for you. Wonderful message. All right, so Toni, what is the best way to contact you or get in touch with you guys? Yep. Well, our website is the best way to contact us. So it's www.returnmed.com.au, and there's an inquiries area there, and we respond to those inquiries within 24 hours. Okay, thank you so much, Toni. All right, so that was Toni Riley, licensed pharmacist and project manager of the National Return and Disposal of Unwanted Medicine Project, or better known as the RUM Project. We just finished talking about the RUM Project and the importance of getting rid of expired and unwanted medicines in order to keep people, especially children, safe. If you like this interview, transcripts and archives are available at www.unwanted.org.
hpr.fm. We are on all social media platforms, so don't forget to follow, like, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabetha Moreto, and you're listening to Health Professional Radio.